One of the things I always think about is if I'm ever in a circumstance where I'm vulnerable, I would absolutely want an advocate, because an advocate, as far as I'm concerned, would be able to be the only person who would think just about me and nobody else. They'd have no other agenda, and they'd work with me closely to make sure that my rights were being looked out for, that everything was happening exactly the way I wanted it. And I think I would probably have enough people in my life who would be able to act as advocates. And I think independent advocacy is really important for people who don't have those people who are natural advocates around them. So that's why I think independent advocacy is essential.
I'd say advocacy is about enabling vulnerable people to get the support that they need and that is available out there to them.
Advocacy means I've got a voice that I'm listened to, and that I can express my point of view and know that it's going to be taken notice of, and that it's just so positive. That's all I can say about it. It's a really positive experience.
It's been like as though somebody's holding their hand out to me and holding my hand through very, very difficult experiences.
A definition of advocacy is giving people a voice and giving people access to the support to support themselves. Sometimes people just need access to information, to advice, need to find a way to navigate through what is sometimes a complex system, and advocacy gives them a route to do that.
It's a process of enabling and supporting someone to talk about their concerns, their issues, their wishes and feelings about whatever it is that's going on in their life. You do it without judgment or agenda. You support people to get access to information and services and to promote their life choices.
Having an advocate really has held my family together. If it wasn't that I had advocacy, I would now be in residential care and the family would all be broke up, and I wouldn't have a voice anymore. I would have lost that, and things would have been so different. So I'm thankful for advocacy services, and I just wish everybody could have an advocate that needs it.
Advocacy, it would be a very good link between you and professional departments who you don't know. I mean, as a person I was vulnerable. I wouldn't go anywhere, I couldn't go anywhere, I couldn't say anything about myself, and I was really embarrassed. They've been my voice, and they've been my bridge, and they are still my link to the professional departments.
The difference that advocacy made in my eyes for service users was that they had somebody outside of the clinical team representing them and making sure that they had a voice and a say in meetings, in multi-professional meetings, which could be very, very stressful. I think also service users met with advocates before meetings, and I think it made a difference for service users to be able to be prepared and to plan and to be kind of walked through the process as well.
Advocacy helps to make people independent and helps people to have choices as well as a voice. They deserve it just as much as anybody else. Just because they aren't always able to articulate it, perhaps because they have speech problems, perhaps because they have memory difficulties, or maybe it could be a confidence issue. When you work with people and you can help them to understand that they are just as important, that these problems are just as relevant, and in some cases the issues are almost life-threatening, and when you highlight that to a person, you can actually get them to understand and to look at the situation from almost like an outside point of view, my concern is always to try and get the person to ask for it themselves if they can. Otherwise, I'll do it for them, or they can do it with me prompting in the background.
As an advocate, we are helping the people who are from black and minority ethnic group, and first language of them is not English. They are speaking, and as an advocate, when we fix them with a bilingual advocate, it is make it more easier for them to communicate and easier for them to mention their needs and what they want, and understanding is much better.
Helps you with meetings, and helps you seeing how you're getting on and this, that and the other. She tries to help, you know, and they're good, really. They're really good. I need an advocate because they help you, don't they?
What would I recommend about having an advocate to somebody else would be the support they would get from an advocate would be second to none. Advocacy would give them a voice, which is incredibly important.
Having an advocate present can make meetings far more efficient because the needs of the advocacy partner can be more easily communicated and understood, and the advice or what the professionals are saying can also be better communicated to the advocacy partner. So by having an advocate there, you're ensuring that everyone's side has been communicated clearly, and this prevents the need for additional meetings or phone calls or follow-up emails, which would often happen if the advocacy partner hasn't fully understood what's happened, or they haven't had the opportunity to ask all the questions that they might otherwise have wanted to ask.
For me, in my job, working with an advocate, I benefit greatly because I feel that part of my role is to support service users and actually advocate for service users. But I've got many roles, and sometimes there's a conflict of roles. For me, I'm reassured that I know that aspect of a person's intervention is being addressed.
If there is an advocate involved, the social worker can have some assurance that actually some time has been spent with that individual, really listening, not asking lots of questions, not having a lot of forms, but just in a fairly low-key manner can get to know the person and get a bit of more understanding of their wishes and their views and what's important to them. If you're an older person who may not have that information at their fingertips and might have more difficulty explaining that, then it can help in those circumstances, and that helps the social worker as well because somebody spent a bit more time. So as a department then we understand, we have a more accurate picture of somebody's needs, and that's in our interests really, to have an accurate picture of somebody's needs so that we can then do the next steps in as well informed a way as we can.
The beauty of good advocacy is that it quite often reduces conflict. It comes about because of the process of working with a person. A person might feel like they are disadvantaged or they have no voice, and that can lead to people feeling quite frustrated, particularly when it feels as if they're surrounded by a number of professionals. So good advocacy, a good advocate, can enter that situation, stand alongside their advocacy partner, and give them the confidence a lot of the time to say what it is that they want. The advocate's job is to ensure that the person is listened to, but to do that in a way that's not confrontational.
I've come across advocacy in a couple of roles that I have. As a GP, I have had meetings with patients and with advocates present, and I find that always helpful. It helps me to understand not only the viewpoint of the person that I'm talking to, but also it helps me clearly communicate the position that I have taken. There have been a couple of circumstances where difficult decisions have had to be made that the individual hasn't always been happy with, and sometimes having an advocate there is really helpful so that you can get across the important bits of how that decision came to be. My other role is as a commissioner. A commissioner is somebody who spends their time trying to work out how services, particularly the health service, can improve. And I have come across advocacy functioning in a very supportive way to help me understand, as a commissioner, the needs of people who are often forgotten about. So by being present, for example, in Newcastle and Gateshead, we have a mental health programme board. By having advocacy around that table, we are able to ensure that we are hearing the voice of the marginalised when we're thinking about how services could be improved.
The other aspect of having an advocate supporting a service user within that multidisciplinary, multi-agency situation is that it helps professionals to be mindful of good practice.
I think we're so supportive of advocacy because all we're here to do is provide the best services that we can. To provide the best services that we can, we've got to understand the needs of the people that we're working with. They've got to understand what their rights are. The more they understand about the services that we deliver, the better services that we can give back to them. So it's a win-win.
Currently, I'm working alongside an advocate with a service user, and the advocate I'm working with is supporting the young person to actually have a voice and to have a say, talks her through the process, plans, prepares, speaks on her behalf during the meeting, before the meeting, clarifies things within the meeting, slows things down so that, or stops things so that the young person can have her say and her voice is heard. And the role of an advocate is incredibly valuable and very, very necessary in that process.
Advocacy is really important in mental health services. It's really important to us as professionals and as mental health organisations to be able to understand people's needs. We need to understand when people are unhappy with the services that we deliver, and advocacy gives people a route to voice their concerns. It's really important to us that people know their rights and can exercise their rights, and sometimes that can be difficult when you're acting under some of the restrictions that are imposed at some times in your life when you're experiencing a mental health problem and getting support. So it's really important to us in so many ways that advocacy exists, and we have the people that we are supporting have access to good advocacy that can support them to express what they want from our services as well as they can.
Although independent advocacy is supporting the individual, I think it has a really important function in terms of making sure that when things go wrong, that those things don't keep on happening again and again. So one of the things that we do is we identify if there's a kind of a cluster or a trend of things that are happening that aren't best practice or could be improved upon. And then we then feed those up to various organisations to see if they can do something to change that. So we call this systemic advocacy. And I think our organisation, because it's linked to and a service of Newcastle Council for Voluntary Service, is really good at doing that. So we link in with Health Watch, we link in with other strategic boards to be able to say, this isn't right. There are areas of work that you do really well, but this particular area needs some improvement. this is the evidence, because we've collated some evidence that lots of people are saying the same thing about this, and we're happy to help you do something about this. And then that means that that one individual who's had some difficulty, the information we use about that is having makes a really big difference on a much wider level.
Advocacy's improved my situation an awful lot, because it makes such a big difference to have and feel that someone's taking notice of you and expressing your views. It might be their views, but your views, and I just feel like life's improved so much.
Advocacy means the world to me. I mean, I get emotional when I talk about advocacy because it means so much to me, and I've had so much support. I can feel myself getting emotional now, sorry. It just means the world to me. They've helped me so much, and I don't even think I would be here sitting on this chair today if it wasn't for advocacy.